Hey everyone, and welcome back to Psych Circles. Today, we're diving deep into the often confusing world of ADHD and bipolar disorder. These two conditions are frequently misdiagnosed, leading to a lot of confusion and difficulty getting the right treatment. Why? Because misdiagnosis can lead to ineffective or even harmful treatments. In this video, we'll explore the core characteristics of ADHD and bipolar disorder. We'll look at their similarities, yes, because there are some overlaps. But more importantly, we'll uncover the critical distinctions that set them apart. Think of it like this. Both conditions can involve mood swings and impulsivity. Ready to demystify ADHD and bipolar disorder? Let's get started. First up, let's shed some light on attention deficit hyperactivity disorder, or ADHD as it's commonly known. ADHD is a neurodevelopmental disorder, meaning it affects the brain's development and how it functions. It usually shows up in childhood but can definitely continue into adulthood. People with ADHD often experience inattention, hyperactivity, and impulsivity. Inattention can look like difficulty staying focused, getting easily sidetracked, struggling to organize tasks, or constantly forgetting things. So what's going on in the brain to cause these ADHD symptoms? Well, research suggests that genetics play a major role. Environmental factors can also contribute. These factors can influence how the brain develops, particularly the areas that control attention, impulse control, and executive function. Imagine these brain areas like air traffic controllers. In someone with ADHD, these controllers might be a little overwhelmed. Now, let's talk about how ADHD impacts everyday life. Tasks that others might find simple, like sticking to a routine, organizing belongings, or completing a project from start to finish, can feel like monumental hurdles for someone with ADHD. This can lead to feelings of frustration, overwhelm, and even low self-esteem. But here's the thing, ADHD is not a character flaw or a lack of willpower. Now that we've explored ADHD, let's turn our attention to bipolar disorder. Unlike ADHD, which is a neurodevelopmental disorder, bipolar disorder is classified as a mood disorder. This means it primarily affects a person's mood, causing extreme shifts in energy, activity levels, and overall emotional state. In bipolar disorder, mood swings aren't just your typical ups and downs. They're much more intense and can last for days, weeks, or even months. During a manic or hypomanic episode, someone with bipolar disorder might feel euphoric, energetic, and incredibly productive. What's happening in the brain to cause these dramatic mood shifts? Like ADHD, bipolar disorder has a strong genetic component. Environmental factors and life stressors can also trigger or worsen bipolar disorder symptoms. On a chemical level, bipolar disorder is linked to imbalances in neurotransmitters, the brain's chemical messengers. When these neurotransmitters are out of whack, it can throw the brain's mood regulation system off balance. Living with bipolar disorder can feel like riding an unpredictable emotional roller coaster. During a depressive episode, a person with bipolar disorder might experience overwhelming sadness, hopelessness, and a loss of interest in things they once enjoyed. These intense mood swings can significantly disrupt a person's life, affecting their work, relationships, and overall well-being. It's important to remember that bipolar disorder is a serious mental health condition, and seeking professional help is crucial. Alright, let's dive into some key differences between ADHD and bipolar disorder, starting with those mood swings we've been talking about. In ADHD, mood changes tend to be more reactive. Bipolar disorder, on the other hand, is characterized by mood swings that are more like tsunamis, powerful, long-lasting, and often unpredictable. These mood swings aren't necessarily triggered by external events, they can arise seemingly out of the blue. Another key difference lies in the duration and pattern of symptoms. ADHD is all about persistence. The symptoms, inattention, hyperactivity, impulsivity, are typically present most of the time, from childhood and often into adulthood. Bipolar disorder, on the other hand, is episodic. Symptoms come and go in distinct episodes, manic, hypomanic, or depressive, with periods of relative stability in between. This episodic nature of bipolar disorder is crucial for diagnosis. Now let's talk about impulsivity. Both ADHD and bipolar disorder can involve impulsive behavior, but the underlying drivers and how this impulsivity manifests can be quite different. In ADHD, impulsivity is often about a lack of inhibition and difficulty regulating attention. In bipolar disorder, impulsivity tends to be more pronounced during manic or hypomanic episodes and often involves riskier behaviors. This can include things like reckless spending, substance abuse, hypersexuality, or making grand, unrealistic plans. This type of impulsivity is often fueled by feelings of grandiosity, invincibility, and decreased need for sleep. Finally, let's consider energy levels. People with ADHD often describe feeling like they have a motor that won't quit. This high energy level is generally consistent, not tied to specific moods or episodes. In bipolar disorder, energy levels fluctuate dramatically with mood swings. During manic or hypomanic episodes, individuals might have boundless energy, reduced need for sleep, and a driven, goal-directed focus. So far, we've highlighted some key differences between ADHD and bipolar disorder. But here's the tricky part. These conditions can sometimes look very similar, especially in their milder forms. This overlap in symptoms is a major reason why misdiagnosis is so common. Adding to the challenge is the fact that both conditions can involve changes in energy levels, sleep patterns, and even self-esteem. And here's where things get even more complex. Some people actually have both ADHD and bipolar disorder. This co-occurrence, while not uncommon, can make diagnosis and treatment even more challenging. When ADHD and bipolar disorder co-occur, it's crucial to address both conditions effectively. Working closely with a mental health professional who understands both conditions is paramount in these cases. Given the overlapping symptoms and the possibility of co-occurrence, it's clear that self-diagnosis is never a good idea. If you're concerned about your mental health or notice symptoms that resonate with either ADHD or bipolar disorder, seeking professional help is essential. A qualified mental health professional can conduct a comprehensive assessment to determine the most accurate diagnosis. Remember, these professionals are trained to differentiate between conditions and identify any co-occurring disorders. Remember, early and accurate diagnosis is crucial for receiving the most effective treatment and support. If you're struggling with symptoms that are impacting your quality of life, don't hesitate to reach out for help. It's a sign of strength and self-awareness, a step towards taking control of your well-being and living a happier, healthier life. Remember, you don't have to navigate these challenges alone. So, you've received an ADHD diagnosis. Now what? The good news is that there are effective strategies for managing ADHD and living a fulfilling life. One of the first lines of treatment for ADHD is often medication. Stimulant medications like Adderall or Ritalin can help improve focus, reduce impulsivity, and increase attention span. But medication is just one piece of the puzzle. Behavioral therapy, particularly cognitive behavioral therapy (CBT), is another crucial component of ADHD management. Beyond medication and therapy, simple lifestyle changes can make a world of difference in managing ADHD. Regular exercise, for example, can help improve focus and reduce restlessness. A balanced diet rich in fruits, vegetables, and lean proteins can also provide the brain with the nutrients it needs to function optimally. And let's not forget the importance of sleep. Establishing a consistent sleep schedule can significantly improve sleep quality. Using tools like calendars, planners, to-do lists, and reminder apps can help keep track of appointments, tasks, and deadlines. Living with bipolar disorder presents unique challenges, but with the right treatment and support, it's entirely possible to manage symptoms and live a full, meaningful life. Medication is often a cornerstone of bipolar disorder treatment. Mood stabilizers such as lithium help prevent the extreme highs and lows that characterize the condition. Finding the right medication regimen can be a process of trial and error, working closely with a psychiatrist to monitor effectiveness and adjust dosages as needed. It's crucial to remember that medication is not a quick fix, it's a tool to help manage symptoms. Just like with ADHD, therapy plays a vital role in bipolar disorder management. Cognitive behavioral therapy, or CBT, can help individuals identify and modify negative thought patterns and behaviors that contribute to mood swings. Lifestyle modifications are equally important. Maintaining a regular sleep-wake cycle, even on weekends, can help regulate the body's natural sleep-wake rhythm. Regular exercise, even moderate activity, can boost mood, improve sleep, and reduce stress. We've covered a lot of ground about ADHD and bipolar disorder, but let's be crystal clear, getting the right diagnosis is absolutely crucial. Why? Because misdiagnosis can have serious consequences for your mental and physical health. It's not just about getting the right treatment, it's about getting the right treatment at the right time. Imagine this. Someone with undiagnosed bipolar disorder is mistakenly diagnosed with ADHD and prescribed stimulant medication. While stimulants can be helpful for ADHD, they can actually exacerbate manic symptoms in someone with bipolar disorder, leading to a worsening of their condition and potentially triggering a full-blown manic episode. That's a situation we definitely want to avoid. On the flip side, someone with ADHD who's misdiagnosed with bipolar disorder might be prescribed mood stabilizers or antipsychotics that aren't necessary and could lead to unwanted side effects. These medications can have significant physical and emotional impacts, so it's crucial to only use them when absolutely needed and under the careful guidance of a healthcare professional. But it's not just about the medications. Misdiagnosis can also lead to a whole cascade of other problems. Someone who's not getting the right treatment might experience increased frustration, a decline in their overall well-being, and strained relationships with loved ones who don't understand what's going on. It can also lead to feelings of hopelessness and a sense of being misunderstood, which can make it even harder to seek help. Imagine trying to manage your life when you don't have the right tools or support. It's like trying to build a house without a blueprint. Frustrating, confusing, and ultimately unsustainable. Accurate diagnosis provides that blueprint, giving you and your healthcare provider a roadmap for effective treatment and management. So, what can you do to ensure you're getting the right diagnosis? First and foremost, don't rely on self-diagnosis or information you find online, no matter how convincing it may seem. Mental health is complex, and what might seem like one condition could actually be something else entirely, or even a combination of factors. The best course of action is to schedule an appointment with a qualified mental health professional, such as a psychiatrist, psychologist, or licensed therapist. These professionals have the training and experience to conduct a thorough evaluation, considering your symptoms, medical history, family history, and any other relevant factors. They can also rule out any other medical conditions that might be contributing to your symptoms. Don't be afraid to ask questions during your appointment. Be open and honest about your experiences, even if it feels uncomfortable or embarrassing. The more information you provide, the better equipped your healthcare provider will be to make an accurate diagnosis. Remember, you are your own best advocate. If you're not comfortable with a diagnosis or feel like your concerns aren't being heard, don't hesitate to seek a second opinion. It's your health, and you deserve to feel confident in the care you're receiving. Finding the right mental health professional can sometimes feel like a journey in itself. But remember, there are people who care about your well-being and want to help you thrive. By being proactive, advocating for your needs, and seeking support, you're taking a powerful step towards a healthier, happier future.